Good evening, everyone. We're letting folks get logged in to the webinar and then we will begin shortly. Okay, welcome, folks. Let's go ahead and get started. There may be a few more that join us, and that's fine too, but we are glad to get this underway. This is the operationalizing the policy using our dental Practice Act statutes and rules and how they practice in North Carolina webinar. We will be meeting for about an hour. We will have time for question and answers, and we will have two other speakers, presenters here tonight. So let me welcome everyone. My name is Steve Klein. I'm the Vice President for Oral Health at the Foundation for Health Leadership and Innovation, which is the organization where the North Carolina Oral Health Collaborative lives. And I'm one of the leaders of that program as well. I'm a career public health dentist in North Carolina and really excited to have this group with us tonight to talk about how we can increase access to oral health care, particularly in community settings. So next slide, please. Yeah. um, why we're here, as most of you know, the North Carolina Oral Health Collaborative operates a statewide network. We work particularly closely with community groups and with safety net dental clinics all across the state. And we have had our ears to the ground listening to what their issues are. And many of them want to take advantage of the, the Dental Practice Act that allows them to work in community settings and provide additional services to these specialized groups. But some of it is confusing, and we all understand that. Tonight, we have the experts here with us to help you understand that and to answer your questions. So that's a little bit about housekeeping. We are offering dental continuing education credit for this hour of education. And you will find in the chat a link to a type form for you to fill out if you would like to get the continuing education credit for that. We will, if you'll submit that to us, we'll get that certificate out to you next week. If you have questions if you have questions during the presentations, please feel free to use the Q&A function of the Zoom. That's not the chat. Don't put the questions in the chat. Please put the questions in the Q&A function of your Zoom. We will have people trying to answer those if they're something quick and easy. We'll also have time at the end of our time together to try to address those questions. And any questions we don't get to tonight, we will follow up with after the session. Um, all right, I want to move on. Next slide to our presenters. Um, Now, first, I do want to acknowledge two other members of our North Carolina Oral Health Collaborative team. The first is Brady Blackburn. He's the Director of Communications at FHLI and has been with the collaborative since his time began with the FHLI. He's a tremendous resource for us and the person behind all the technology and all the workings that we're using tonight. So thank you, Brady. I also want to introduce Abigail Martin. She is the newest member of our collaborative team. She is the operations program manager, and she keeps our day-to-day running. She's not going to wave at you on the camera because her camera's not working right tonight, but we welcome Abigail here tonight and her as part of the team. Now, next slide, please, Brady or Crystal. Our first presenter tonight is Crystal Adams. I suspect she needs no introduction to everybody on this webinar because she has known around the state for working with the collaborative for a long time. She's a certified dental assistant. She's a licensed registered dental hygienist. She also has a master's in higher education, and she's been with the collaborative for more than 4 years. And she has really dug in to try to understand what it means to be practicing under these provisions in the North Carolina Practice Act. So she will present first, and then we will hear from Mr. Bobby White. Bobby White is the CEO of the North Carolina Dental Board. He is a lawyer, a law degree from North Carolina Central, and also has a Master in Divinity from Duke University. He's been with the state board for more than 20 years. So any question you have, Mr. White is going to be able to answer, I'm sure. So I will turn it over now to, I'm sorry, one more. Next slide, please. I always forget the disclosures. We want to make sure everyone understands that the collaborative is not the authority on any statutes, much less the Dental Practice Act. We are here to help you understand the similarities and differences and what it means in the Practice Act, but we do not represent the State Board of Dental Examiners. All the materials we're going to be using are for education and not intended to be interpreted as law or an interpretation of the state law. It's important that if you have questions and concerns about a practice under the Dental Practice Act, you need to get clarification on that from the North Carolina State Board of Dental Examiners. Thank you. Now, next slide. And I will turn it over to Crystal.
Thank you, Steve. And thank you, everyone, for joining us this afternoon. I know it's probably not very exciting to look into statutes and laws and rules on a Thursday afternoon at 6:30. I'm sure you could be using your time somewhere else, somewhere way more fun. So we appreciate you being here. I am going to be talking tonight, as Steve mentioned, about the general statutes for the public health hygienist and the limited supervision hygienist. Before I dig into some of these rules, Bobby will be co-presenting with me, and he is going to talk about the difference between a law and a rule and who is responsible for changing the laws and rules in North Carolina or who has regulatory authority over that. So, Bobby, I'm going to pass it to you.
Okay, well, thank you, Crystal and Dr. Klein. I appreciate the opportunity to be here and to all who are joining us. One of the things that I find consistently as I go throughout the state talking to various groups is that a lot of folks think that the dental board passes the rules and statutes that govern dentistry. And that just simply, nothing could be further from the truth. The general statutes are obviously passed by the General Assembly. And in fact, the North Carolina administrative law prevents the North Carolina Dental Board from doing anything to advance or defeat any kind of legislation. So the statutes are passed by the General Assembly, your elected representatives. And the statutes usually come through professional organizations, the American or the North Carolina Dental Hygiene Association or the North Carolina Dental Society, propose changes to statutes or amendments to statutes. And apart from the fact that sometimes various committees in the General Assembly ask me or other members of the dental board to come down and comment on proposed statutes. Other than that, the board really has no role in the adoption of statutes. And like I said, by law, we can't do that. The statutes give the authority for the board to enact rules. The statute may state a general proposition. For example, to apply for a dental hygiene license, one must be a graduate of an approved program and be of good moral character. That's kind of a broad statutory language, and so the board can propose rules that would say, well, what does it mean to be of good moral character? What evidence do we need to have that a person has graduated from an approved program? And so we can propose rules that would put flesh on the bones of the statute, so to speak. But even then, the board only proposes rules and proposes language, and the rules themselves have to be approved by a group that's called the Rules Review Commission, which is a subcommittee of the North Carolina General Assembly. But we have to have public hearings on those rules. We have to gather evidence. We have to get some idea of what how these rules are supported, how much support they have in the affected community, and what kind of economic impact they might have on the public or the impact or licensees. And once we collect all that data, then we can take the proposed language to the Rules Review Commission, and they can approve it, or suggest that it be approved to go into the North Carolina Administrative Code. So, in terms of statute and rule, statute, the board is hands off basically because we're forbidden by law to advance or defeat any kind of legislative initiative. In rules, we can propose, we gather information, we propose language to put flesh on the statutory authority that we've been given. But in the end, it's the Rules Review Commission that makes the call as to whether the board has authority and the language that's in those proposed rules is appropriate in light of the authority granted by the statute. It's a convoluted process, and if you ever want to have a mind-numbing experience, you should go to a Rules Review Commission meeting sometime where they're discussing passing rules on any kind of professional organization, professional licensing board. But that's a bit of a background, just to say that I would disabuse you of the idea that the dental board is kind of a high and mighty organization that's passing rules and making statutes that govern dentistry, because we are a conduit for that, but we certainly are not the authority for doing that.
Thank you, Bobby. And I guess I would love to attend one of those meetings. I've been telling you, sometime when I'm in town, I'm going to have to join because I love the rules and the statutes and so forth. So you'll have to send me some dates.
Okay.
Okay, so I want to dig in. So we have the statute, which is 90-233. That's the law. I want to talk about, a lot of you on this webinar probably have heard 16W, 16Z. And these are the two rules, as Bobby was talking about. They are the regulatory body. They do not regulate the law, the statutory authority over these rules, but these are the rules that they oversee for the practice of dentistry in North Carolina. 16W is titled the Public Health Hygienist, and 16Z is titled the Limited Supervision Hygienist. And in this webinar, we're really going to dig deep into these rules and statutes because it's kind of spread throughout the statutes and the rules. But I just wanted to highlight the different sections of each rule, how they're defined. It talks about the training that is necessary. A lot of 16Z is listed in the statute. So, and then there's actually some things that are listed in the statute and the rules, which usually doesn't happen now. But a long time ago in making these rules, it was duplicated somewhat. So when you're digging into these rules, it can get a little bit confusing. So hopefully we're going to be here to help you to walk through these rules as they stand. So I'm going to go to the next slide, and we're going to answer the first question of who can practice as a public health hygienist or a limited supervision hygienist in North Carolina. So number one, who can do it? Well, all hygienists and assistants are supervised by a dentist. So no one can practice under these rules in North Carolina without the supervision of a dentist. And we'll talk about follow-up and so forth in some slides moving forward. But number one, no matter what, in North Carolina, we will always be under that licensed dentist, which gives me a lot of help to know that it's not all the care's not on my shoulders. I can give that to the dentist. So I enjoy that part of it. But and I don't want to say 16W versus 16Z. I want to say public health hygienist because as I said, some of it's taken out of statute, some of it's taken out of rule, is if you are employed as a public health hygienist and you're employed in a local health department, state government, public health program, an FQHC, or and trained, I guess I should say, and trained by the oral health section. So if you want to become a public health hygienist, you have to work in one of these places. And in addition, you have to take extra training through the oral health section. Once you do that, then if you're supervised by a dentist, then and you meet the other requirements of this rule or the statute, then you can become a public health hygienist. Limited supervision hygienist. It's a little different in the language. So, and we'll talk about trying to make these a little bit more easier to understand in the future at the end. But right now, as the language stands, a limited supervision has to have an active license. That doesn't mean a public health hygienist has to have an active license as well. But it's specific in limited supervision hygienist. They are designated by their dentist that they are capable of performing clinical hygiene procedures without that direct supervision. So in both of these public health hygienist and limited supervision, you can actually practice without the dentist on the premise. So, which is nice because the dentist can also be treating patients while you're in different type settings treating patients. Another addition to the limited supervision hygienist rule is you can't have any disciplinary action as a dental hygienist in any state. It doesn't just mean North Carolina. So if you have license in any other state, you cannot have any disciplinary action at this time to practice in this role. And also, and it's just not written in public health hygienists, but it's written out for limited supervision hygienists. We have to follow the Dental Practice Act. We all know that, or our license can be in danger. And then we want to always cooperate with the board if they want to come in and do any inspections at any of the sites where this treatment is provided. So that just gives you an idea of who. So the biggest difference with the public health hygienist at this point is they have to take that additional training through the oral health section. And of course, there are other things under the limited supervision, but you would there's other parts of the rules and statutes that you have to have an active license to be able to practice dental hygiene in North Carolina. Bobby, anything on that?
No, I would just say that the limit, history, a bit of history behind this is that, of course, the public health hygienist statute was in place for years. And then the limited supervision hygienist sections of the statute were added, I think, in 2007, somewhere along that. And it was the attempt here was to have dentists in private practice be able to send hygienists out to designated areas, as you see there, um, uh, long-term health community, federal, state, community government clinics, qualified health centers, those kind of things, to allow not just public hygienists to do that, but dentists in private practice in underserved areas to send hygienists out to those types of facilities in order to kind of expand the access to care.
Thank you. And this is all about access to care, getting to our community, serving those patients that are not able to access care. We always say just because there's a dentist down the street from someone doesn't mean they have access to care, because they have to have the insurance or the financial support. So that's what we are trying to eliminate, is some of those barriers that we can provide as a hygienist underneath the dentist in serving some of these patients in these communities. So, as we move forward, talking about the requirements of what qualifies you to become a public health hygienist, this is where there is a lot of differences. So, and it gets confusing unless you do have these side by side. But public health hygienist, there's has to have 5 years of experience. So it also includes a minimum of 4,000 hours, or the majority of which must be spent chairside or performing prophylaxis or cleanings or periodontal debridement. So you can't just be a hygienist for 5 years and say, oh, out of those 5 years, I've practiced maybe a year and a half. You have to have that 4,000 hours in addition to the 5 hours. Also, and I'm just going to jump over to the limited supervision. This is a difference, as in 3 years of experience for the limited supervision hygienist. So there are differences. So whether you're 5 years or whether you're 3 years, some people look at these rules and say, well, I've had the 3 years of experience, so I'm going to practice under the limited supervision hygienist. Well, in that case, if you're going to practice under the limited supervision hygienist statute and rules, then you have to make sure that all the boxes are checked for the limited supervision hygienist. So you can't just pick out pieces of each of these
Right.
rules and statutes. It's got to be all of it. So, Bobby, do you want to talk about here how the difference in the statute, where one is in the statute and one is in the rule?
Right. And there's been some confusion because let's just take the first line here. The highlighted line, 5 years for public health hygienist, it says 5 years and 4,000 hours. Limited supervision says 3 years and 2,000 hours. In the limited supervision hygienist, as you can see in the reference there, you see 90-233A1. That's actually in the statute. So that's something that the board cannot change. Again, we go back to that concept of changing statutes is beyond the realm of the board. Other agencies or other individuals have to be involved in that. So there's been some confusion about that and some desire on the public health side. You have 5 years and 4,000 hours, but that is a rule. Conceivably, the board could propose, if asked, the board could propose a rule to change the language of the public health hygienist to match the limited supervision hygienist, because as we said earlier, the board can propose language for rules, can't propose language for statutes. And so if there was a desire to bring these two together, and I think there is, we would have to change either change the public health hygiene rule, or bring it together under the statute for limited supervision hygienists so that they would be the same.
Thank you. So also the CPR requirement is different. And this is another change
Yeah.
we would like to see happen. And again, it's like Bobby said, for a public health hygienist, as long as it's unexpired CPR, and as long as you've had that hands-on experience, you're good. But when you get to the limited supervision hygienist, there's two different, in the rule or in the statute, it says you have to have annual CPR. In the rule, it says maintain current CPR. So hopefully we would love to see that annual CPR change, just because most CPR classes and trainings are for a 2-year period. So, but that's another complication of this. The reason it hasn't been changed is because it's statute versus rule. Bobby, chime in anytime you want.
Well, that's a perfect example, Crystal. The board has tried to take the pathway of saying whenever CPR is mentioned in dentist or dental hygiene, we want to say unexpired or current, because, like you said, they're different, maybe a 1 year or 2 year program for the CPR classes that folks take. But because in 2007, some legislature, in his or her wisdom, put annual CPR in the certification in the statute. That's something actually would have to go back to the General Assembly to to bring it in line with what the board knows to be the current state of affairs with CPR. Current, maybe 1 year, maybe 2 years, but current is all that we need, not an annual certification. But it's there in the statute, so that would have to be changed by legislation, not by rule.
Yes. And then continuing on, what kind of training? Both public health hygienist or limited supervision, you are required to take a 6-hour continuing education course in medical emergencies every year. And this has to be in addition to the minimum requirements. So we as hygienists have to have 6 continuing education credits. So we would have 12 if you're practicing, or you will need to have 12, 6 of those being medical emergencies to practice as a public health hygienist and limited supervision hygienist. Also, as the public health hygienist, I mentioned this earlier, but I feel like the more things that we can mention about these rules and understand them is that training that's required by the oral health section. The oral health section is great to work with. It's pretty much an on-demand course. They've done a great job designing the course, so they actually send out those dates quite frequently, and so you can take that if you want to become a public health hygienist and meet the other requirements. Okay, moving on. So where can they practice? So this it shows you how one word, just like Bobby was talking about, public or annual, one word can make a big difference in the statute and rules. So where can they practice? What sites can they practice? They're pretty much all the same, and I'm not going to read them out on the slide. I know all of you can see the slides, and we're happy to share them in this webinar is being recorded as well. But I do want to call out with public health hygienist, in the rule, it states public schools. In limited supervision hygienist, it says they can practice in many schools. The reason this is important to us is because with access to care, we know in North Carolina with the vouchers, there's a lot of students that are going to schools that are being started in smaller counties that maybe still will not have, if they're not in the public schools, they may not have access to oral health care. So again, with what we're trying to do with access to care, we want to meet the patients and meet them where they are, so they can get access to care. It may not be a public school. We may need to go to a school that's at a church. We may need to go to and charter schools or public schools. I'm aware of that. But there's all these schools that are popping up in North Carolina that we need to make sure that we serve, because some of them are going to be in communities that don't have access to care. But other than that, this is pretty self-explanatory. Again, some of it's in rule, some of it's in statute.
Crystal, I might just make a comment here. We get a lot of questions at the board, like a limited supervision hygienist, where a dentist may say, "Well, I'm going to be out of the office Friday, but I want you to be here to see patients, and I'm going to, we're going because you have a standing order and you can do that." But notice that limited supervision and public health, they are facility specific, and the private office is not listed here. We get a lot of pushback on that from time to time about, well, why can't I just have this occur in my office? Well, because the statute does not list an office as a place where this is appropriate.
that's interesting, and that's good to call out, because
Right,
we get questions about that. You know, can I, in what kind of setting? They don't always
yeah,
understand the setting. And that's why it's so important that you have to understand the whole statute and the rules. And
right.
that's why we're here tonight. So, how do they practice as a public health hygienist or limited supervision? So, both of them, again, I want to say under the direction of a dentist. So, the dentist will provide a written standing order. Instead of them being in person, they will provide a written standing order of what that hygienist can do in the settings that we just talked about, whether that be a public school, a nursing home, any of those centers or any of those locations we just talked about. That written standing order is the dental hygienist has 270 days to complete the treatment of what they're allowed to do. So the good part about this is a dentist has the authority to allow or not allow the dental hygienist to do things in these settings, whether that be they can do cleanings, it's whatever they feel comfortable with the hygienist performing in those or in those locations. So whatever's on that written standing order will be what the dental hygienist can do. So also, I do want to call out with the limited supervision, and I believe, Bobby, if I'm correct, there's something going in for the public health hygienist, and we want this to actually say the same things pretty much when
Right.
in our proposed changes. But as now, currently, the limited supervision requires a licensed dentist to be available to provide appropriate follow-up care as necessary. Bobby, I'm going to defer to you because this is something that we always have a lot of questions on, and you're the expert.
Well, that number 5 under limited supervision was put into the statute uh, because we had a number of how can I say, less than scrupulous practitioners who would provide services. Let's say go to a school and serve a number of underserved, low income students, and would kind of cherry pick the uh, the procedures that they may do the X-rays, they may do the prophy, they may do any number of things, and then they would just tell the student, well, you need a restoration here, go see a dentist, and leave the school. And so the students were, their Medicaid funds, for example, were used up, and there was noted that there was restoration work needed or additional work needed, but no pathway for that to occur. And so, with the limited supervision hygienist, which remember, this is a hygienist that's involved in a private practice, that was put into the statute uh, to ensure that students weren't kind of just left without any options. If you're going to go in and take x-rays and do prophies and sealants and find out that the student really needs more work to be done, then the dentist who provides or authorizes that limited supervision hygienist to do that work. And it is increases access to care because the dentist doesn't have to see the student or the patient first, but they have to be able to do the follow-up, or that just leaves the patient in a worse position than perhaps than when they were first seen. But
And definitely,
yeah.
go ahead.
No, but so that's not in the public health hygienist statute or rule.
But it is something that, is it going through now through open comments?
We have usually working with the North Carolina Dental Society and the North Carolina Oral Health Collaborative, we have drafted some changes to the statute that would have to go through the General Assembly, and those will be proposed, I guess, either through the North Carolina Dental Society or the North Carolina Oral Health Collaborative to bring this. Like I said, we want to, as much as possible, bring the two, the public health hygienist and limited supervision hygienist rules and statutes together so that they are aligned.
Thank you. And definitely, we want to encourage a dental home. If you go in and see a patient, they are more than likely, especially in these communities that we're serving, they're going to need follow-up care. So you can't just go in and cherry pick and do the easy work. You know, you need to stand beside that patient and remember, why are we in the field we're in? Because we want to care for these patients and we want to see their oral health care improve. Okay, so this was exciting for dental hygienists in North Carolina. So, supervision of a dental assistant. So, just as a dentist cannot work without a dental assistant in their practice, you know, we need dental assistants to help us in the work. Dental assistants, I can't talk about how essential they are to the practice of dentistry. I'm actually a certified dental assistant, so that's close to my heart. But when the board went through all these rules, they did allow for supervision of a dental assistant by a hygienist. So that dental assistant has to be classified as a DA2. Now, we get a lot of questions about this because people say, well, how many assistants? It says a dental assistant. So that's what I want to call out. One dental assistant right now. Now, again, we're going to talk about potential changes in the future, but whenever it says a dental assistant, that means one dental assistant. So and so then we get questions on top of that one. Well, what happens if I'm in a school setting and I have two dental assistants with me? Bobby corrects me if I'm wrong, but as long as only one is practicing as a DA2, it's okay. If the other one's doing paperwork, if they're doing charting, if they're doing non-dental related activities, or they're not doing clinical, any of the permitted functions by a DA2, you can have two DA2s. They just can't be doing the work at the same time.
And that follows the board's interpretation that's happened with dental hygiene, where it says, you know, dentists in private practice may supervise no more than two dental hygienists who at one and the same time are involved in clinical procedures. There may be more dental hygienists in the office doing things other than clinical procedures at that time. So the same thing as you just explained with dental assistants here for dental hygienists working with dental assistants. And again, this may be something that organized dentistry, the collaborative dental society, the hygiene association may want to look at us or the General Assembly to change.
Okay. So we're getting to all the pieces of it. So now, how many dental hygienists can a dentist have? Another big question, Bobby. I'm sure you get this because we get this often too. So again, the public health hygienist was created. Well, both of these were created for access to care. The limited supervision allows private practice dentists to practice in these types of settings with a hygienist in indirect supervision capacity. The thing that I want to call out, another big difference, is a public health hygienist can super, or a dentist that's public health in a public health hygiene, or excuse me, let me go back. A dentist that's in a public health setting that supervises a public health hygienist can supervise more than two public health hygienists. My words are getting all messed up here. But a limited supervision hygienist, if you're in a private practice, you can only employ or no more than two dental hygienists. So in the statute, it states that it specifically calls out private practice. So because that's in the statute, private practice can not have any more than two. Public dental health, it does not mention that specifically, so they can, and it's written in, I believe, Bobby, the rule, if I'm correct, for public health hygiene.
That is exactly correct. And if you look at the under this limited supervision hygiene on the right of your screen, those words in private practice are essential. They're in the statute. And so when we talk about public health hygienists, obviously in public health, the HHS and other groups, that's not private practice. And that's where language is so important in statute and rule. And that came to the forefront several years ago as the board had been asked to look at rules and statutes, and we had to say that this may not employ more than two dental hygienists, one at the same time, applies only to private practice. So, public health dentists may supervise more than two hygienists, whereas private practice dentists could not.
Okay, and this is the bear that we don't want to talk about, but we have to. So, annual reporting requirements. So, Bobby probably, this is his most favorite part of the rule and the statute because it's
Oh
in
boy.
both places. So, public health hygienist, how do we document everything? We chart. So, the board, there's rules and statutes and so forth stating that we have to provide specific documentation for our patients. And that's exactly what we do with the public health hygienist. So there's not any annual reporting requirements. However, again, Bobby talked about the history of the limited supervision hygienist, and there's a long list of reporting requirements that must be done annually. It's a pretty hefty list, talking about all the hygienists, all the locations, all of the schedules reflecting the locations. There's a lot of specifics in here that if any of your hygienists practice as a limited supervision hygienist, so if you decide to say, hey, I only have 3 years, can't practice as a public health hygienist right now, I'm going to practice as a limited supervision, then you have to annually report, the dentist must annually report this to the board. So, Bobby, since this is your favorite piece, I'm going to let you talk about how great this information, or let me say how inefficient it is.
Let me just say that I think this has a great chilling effect on a private practitioner dentist using a limited supervision hygienist. Once this law was enacted, 10 or 12 years ago now, I have to send out a survey after the renewal period. And one of the questions in the renewal period for dentists is, did you utilize the services of a limited supervision hygienist during the course of the past year? First of all, a lot of dentists are confused about that, and they check yes. So anybody that checks yes, we have to send out, the board has to send out this survey asking for all of this information to be provided to the board. And one of the things that I added to that survey was one question which said, now that you've gotten this survey and looking back on things, did you answer correctly on your renewal form? And most dentists said, whoa, I had no idea. I thought this was something else. And probably 80% of the dentists who said, yes, I utilized the services of a dental limited supervision hygienist, say, I was incorrect, check no, and then they don't do the survey. But those who do, this is a kind of an onerous reporting requirement. We have collected this data every year. It's sitting on shelves in our board files. To the best of my knowledge, it has been utilized one time, and that was by a master for a master thesis in dental hygienist by a person at UNC Chapel Hill. It turned out to be a good analysis of the situation. But again, when you have this kind of reporting requirement, it just adds paperwork, charting, and schedule reflecting of schedules throughout the year. It's difficult to collect, and it's not proven to be beneficial information for I think the use of the limited supervision hygienist.
So, while we like data, we want to make sure that the data is going to be useful, not sitting on a shelf. So
Right.
this is not something that we want to continue doing. Okay, so this is the last piece of digging into the rules before we talk about some other, well, similarities and comparing the two. But just some other things that were listed in the limited supervision hygiene rule is that also if a dentist has been disciplined by the board, they cannot allow a hygienist to work outside of dentist direct supervision. So they would not be able to practice as a limited supervision hygienist. Also, and I would say this goes for both because there's other pieces of the statutes and rules that probably refer to this, but everyone has to be in compliance with both CDC and OSHA standards. So that's just part of the statute. So even though it's not listed as something in the public health hygiene rule or statute, I think it's still expected by I don't think, I know it's expected by the board. So, okay. So, Bobby, we're going to move on and we're going to talk about similarities. So, just real fast, because I know I want to allow enough time for some of the questions at the end. But pretty much both are going to allow dental hygienists to work in these specified areas for dental hygiene services or what is in that written standing order. Both of them allow dental hygiene services outside of that direct supervision as long as that dentist is comfortable, as long as that dentist gives that dental hygienist permission, then they are allowed to practice in these settings. Both allow for the supervision of a DA2. And then, of course, the intent of both is to safely and effectively expand oral health preventative services. We know many of our communities in North Carolina do not have access, again, like I've said earlier, to oral health care services. And that's what we want to do. We always have to remember why we went to hygiene school, why we went to dental school. We want to serve our patients and make sure they get the best care possible. And then, of course, you have to have that 6 hour medical emergency training. And that, again, is in addition to the 6 hours. So some differences. This is a whole mumbo jumbo. I'm not going to read this out. I'm just going to call out pretty much the training or not really the training requirements, but the requirements to practice under these two rules are different as we called out. We called out the CPR. We called out public schools versus schools as far as the locations. We talked about the disciplinary action. We talked about the number of hygienists in public health versus private practice. So we know that there's differences. What we would like to do is the North Carolina Oral Health Collaborative, along with the North Carolina Dental Society and the North Carolina State Board of Dental Examiners, has come together and we have worked to eliminate some of this confusion, I would say. So I'm going to talk about what we have proposed. We brought many of you probably watching this webinar was probably a part of this change. We could not have made this change without your voice because you are the ones that are working under these rules. You are the ones that know what creates barriers to this care. So with your voice, we have been able to work with these partners, and we think NCOHC wants to thank the Dental Society and the board for letting us be a partner in this. But what we have proposed as partners is to decrease, well, for one, align the requirements to become a public health or a dental hygienist in these settings and decrease it to 2 years. Excuse me. Let me I need to see my screen. 2 years prior to qualifying as a public health or a limited supervision dental hygiene, that you have a minimum of 2,000 hours. So, and again, that has to be 2,000 hours of actually providing treatments to your patients. So you have to be able to prove that. Again, we want to make sure that both of them maintain unexpired CPR. We want to get rid of that annual. That way there's no, whatever CPR class you take, whether it's under the American Health or American Heart Association or under American Red Cross, you're covered as long as it's unexpired. Then we want to clarify I brought attention to the disciplinary action that's in the current rule and statute for the limited supervision hygienist. What the board has recommended that would make things a lot easier is to say, instead of talking about disciplinary action or disciplinary action from the board, that means a lot of things. What does that mean? Does that mean you got a letter from the board? Does that mean that you've had your license revoked from the board? So there was a lot of confusion around that. So the board has came up with some language that would state dental hygienists and dentists who hold an active license in good standing. And in that they would define what good standing means, which means that that if you have a dental hygiene or dental dentist license, that it's not suspended, revoked, or there's not any disciplinary action with probation with that. So just clarifying that language, I think would help people understand. And whenever I say these proposed changes, they're for both rules. What we want to see is both changes for public health hygienists and unlimited supervision have both of these in them. Requirement for follow-up for care. Bobby mentioned this earlier about having the language so that way it's in both for both hygienists in these settings. And it would state that a licensed dentist is accessible either in person or via synchronous teledentistry for consultation while the hygienist is performing clinical procedures. Now, and they can't if they have to be somewhere that hygienist can get in touch with them. And if any follow-up care is necessary, they have to be able to provide follow-up care. So there has to be a dental home to refer those patients to that need the additional care. Now, I had a lot of questions about this synchronous teledentistry. That was probably my biggest thing, is because if the dentist has to be there in person or via synchronous teledentistry, what does that mean? That means that if you are providing dental hygiene services in one of these approved sites, then you have to be able to get in touch with the dentist. So they have to be there to guide you, because again, dental hygienists don't want the responsibility of a dentist. They want to be able to call that dentist and say, the dental hygienist wants to be trained well, but they also want to say, okay, this is what I'm experiencing. What do I need to do in this situation? What do you want me to provide in this situation? So they have to be accessible. That could be by telephone, that could be by asynchronous teledentistry means. So there's multiple ways. So Bobby, I'm just going to take a minute. I think that's several before I go to the next set of changes and do you want to talk about any of these changes?
Well, I think that especially with the disciplinary thing, the language that a dentist or dental hygienist who's been disciplined, the board is a firm believer that, a mark on one's record shouldn't last forever. So a person can can be out of good standing, could be on probation for a while, for example, or being asked to go back take additional courses or something. That won't last forever. So that, a mark on one's record would not keep you from participating in these programs or in these as a dental public health hygienist or limited supervision hygienist or a dentist forever, because good standing is often restored and actively restored to dentists who and dental hygienists who fulfill the terms of their probationary orders. I don't want you to, I wouldn't want people to think that the board out that takes any delight in removing people from active practice in dentistry. That's an in and out situation for most dentists and dental hygienists who receive any kind of discipline from the board. And
Oh, let me go back.
no, that's fine. I mean, that's it. I just was saying synchronous, like you mentioned, synchronous teledentistry, that is defined in the teledentistry or the teledentistry is defined in the teledentistry statute. It can be any means of electronic. It could be a telephone, it could be a computer, it could be an intraoral camera, whatever it might be. There are a number of ways for synchronous teledentistry to occur.
Okay, so again, some other changes that have been proposed is increasing the number of days for that dentist standing order. We are hearing from a lot of our partners that sometimes it's hard for them to get into the schools, especially now with the Parents' Bill of Rights. And so increasing that from 270 to 360 days. We would also, again, as we talked about those reporting requirements, get rid of those for 16W or well, and they're also in the statute, but just making a statement that a patient record has to be maintained. And with that patient record, you would have to comply with the requirements of 21 NCAC 16T, which is another rule. And then you would also need to include the location of the treatment that's provided. And then, of course, another addition to this would be increasing the number of dental assistants with the language stating no more than 2 dental assistants, and they would have to be DA2s. So I just want to stop here for just a minute and say these are proposed changes. If they're approved, they will be incorporated. The majority of these will be, and pretty much all of them, I guess, will be incorporated in the general statute. Right now, no one on this call has control over these changes. As Bobby said, it's going to take legislative action for these changes to take place. So we are actively working. The Dental Society, we want to thank them. All of the partners are working together to propose these changes and put them forth. So that way it makes these rules a little bit more aligned, easier to understand. So we're hoping that this happens, and we want to thank everyone that's been able to use your voice to make these changes and lifted up these barriers to care. Anything on that, Bobby?
That sounds good.
Okay, well, I'm gonna breeze through these last couple of slides because I think we have like 2 minutes, but I do want to just talk about a couple little things. Pretty much what we talked about tonight was 16W and 16Z. So what you see on the screen right now are opportunities for NCOHC's opportunities for policy changes. So what we talked about tonight, these are some proposed changes that we would like to see happen just to make it easier for the dentist to be able to sleep at night, that they're following the rules, the dental hygienist making sure that they follow the rules. Because as an educator of dental hygiene students, with the dental hygienists, they want to follow those rules. They do not want to break them. And dentists, I think, are the same way. So I'm not really going to, we've covered all of that. We also hope to see an increase in the North Carolina Medicaid dental reimbursement rates, and I'll talk about that a little bit further down. We would also like to, we've been working with Medicaid to potentially see if we can get some reimbursement for the school-based dental examinations. So we're actively working on that. More information will be forthcoming as we work with Medicaid and try to get some of these services, such as periodic oral evaluations, covered. And then again, we would like to work with the North Carolina State Board of Dental Examiners to collect data probably for workforce development needs. Not data that's not going to be used for how many years, Bobby, that reporting stuff wasn't used, but data that's going to be used on an annual basis to say, what do we need in North Carolina for our workforce to have enough of a workforce to serve our communities. So I know that's a lot. If you have any questions about the policy changes, some of these we are more actively working on than others. Definitely we haven't gotten, we're hoping to talk to the board about the data piece later throughout the year, but we're trying to work on Medicaid and some of these changes with 16W and 16Z first. And then lastly, as I mentioned earlier, we all of you on this call, I don't know how many is on here, but I'm sure we'll find out later. We all need to contact our legislators. We need to support this NC House bill to modernize Medicaid dental rates. I know it's an uncertain time, but we need to let them hear our voices. That the sustainability of our clinics that provide this access to care needs an increase in order to keep our doors open and continue to provide this care to our patients. So please reach out to your legislators. Please reach out. I know NCOHC has sent out an email. NCDS, we thank them for their partnership because they've been a strong partner with this bill. They've let us be right beside them with correspondence and helping us in this territory of modernizing these Medicaid dental rates. So now we're to questions. And Steve, I'm happy to see you there again. And so I hate that I didn't leave more time, but I hope if you do have a lot of questions, Steve, are there a lot of questions that need to be answered or
Yeah, so there were some great questions that people put in the Q&A. And some of those we will want to consult with Bobby and the board before we answer them, but to make sure we're giving you the right answer. So we will follow up with that. I will tell you, the ones who put questions in the Q&A as an anonymous participant, we're not going to have a way to get back in touch with you. But there were some great questions. We will take those under review. We will send out some information about that if we have your contact information. There was just some details I think that needed to happen. I know we're over time already, so I appreciate everyone being here tonight. You know, honestly, we were overwhelmed with the number of people who registered to be part of this, and I think it's just points to the confusion and complication of these rules that we hope we can clean up because we do believe there are a number of providers in the state that really want to help increase the access to care, and we want to help you do it. So thank you all for attending tonight. We will follow up on the questions that we have contact information for. And even if we don't, it may influence some of the changes that we're talking about making happen. So thank you all for participating and have a good rest of your evening.
thank you,
Well,
everyone. Thank
thank-
you, Bobby and Dr. Klein.
and same thanks to the both of you.
Absolutely. Thanks, everyone.
Has the recording stopped?